On today's program, I will touch on the subject of death, that ultimate passage from this life into another realm, a passage that we all face in this, our terrestrial life. Some time ago, I had an interview with Stanislav Grof and Joan Halifax Grof. Stanislav Grof is the well-known Czech medical doctor and researcher who has done extensive work on the use of LSD in terminal cancer patients. Much of his work has been done in Maryland at the Maryland Psychiatric Research Center and various hospitals of that area. Joan Halifax Grof, his wife, is an outstanding anthropologist who has done considerable work in the subject of rites of passage, especially in the Caribbean and North African areas. Together they form a remarkable couple who, with great knowledge, compassion, and human warmth, have done much to ease the pain and anguish of terminal patients and help them in their ultimate transition from this life. So I present now portions of that conversation I had with them. Dan and John, I was interested especially about what we might call the ultimate rite of passage, that is death. And you have been doing a lot of research with terminal cancer patients and LSD. And I would like to ask you if you could describe briefly what you have observed in this passage, in this transition from life to death in these patients. Some of the feelings that they have expressed in this state.
I think it might be very interesting to talk not about one of our patients, but an experience that Carl Jung had at the time of a heart attack when he died a so-called clinical death. I have an account here which might be appropriate to read. It's very,
yes,
very beautiful.
Please.
Jung has this account of what happened to him after a heart attack when he was in a state of unconsciousness and he literally hung on the edge of death. He said, "I found myself in an utterly transformed state. It was as if I were in an ecstasy. I felt as though I were floating in space, as though I were safe in the womb of the universe, in a tremendous void, but filled with the highest possible feeling of happiness. This too is eternal bliss," I thought. "This cannot be described. It is far too wonderful." In the course of his experience, Jung found himself floating away from the earth, which he saw from a distance of 1,000 miles and bathed in a glorious blue light. As the experience progressed, he envisioned himself standing before a temple, the door of which was surrounded by a wreath of flames. "As I approached," Jung said, "I had the feeling that everything was being sloughed away, everything I aimed at, or wished for, or thought, the whole phantasmagoria of earthly existence fell away or was stripped from me, an extremely painful process. I had the certainty that I was about to enter an illuminated room and would meet there all those people to whom I belong in reality. There I would at last understand, this too was a certainty, what historical nexus my life fitted into." Jung then for a time saw himself in an enchanted garden of pomegranates, where all was beautiful and peaceful. Of the entire experience he said, "It is impossible to convey the beauty and intensity of emotion during these visions. They were the most tremendous things I have ever experienced. I can describe the experience only as the ecstasy of a non-temporal state in which present, past, and future are one. Everything that happens in time had been brought together into a concrete whole. I was interwoven into an indescribable whole and yet observed it with complete objectivity." I feel that that description has a tremendous validity. We, in the course of our work with individuals who are dying of cancer, have had several occasions to hear the accounts from our own patients of their own clinical deaths.
When they died and they came back, they were resuscitated.
These accounts invariably contain several elements. One of the elements has to do with tremendous resistance, something I'm sure we all experience when death is staring right in our eyes. And this resistance takes many forms. It can, for instance, take the form of suffocation. It's very, very frequent. Then another stage has been described by Russell Noyes, who is collecting experiences of clinical death, and he calls this second stage life review. It's almost a karmic review or last judgment scene, as we've seen it in our patients, where all their misdeeds seem to come back to them or can come back to them, and they have a tremendous sense of overwhelming guilt and then forgiveness.
On some other occasions it can be the positive things. It's like a sort of total synthesis of their life up to that point of death.
You may say both the positive as well as the negative karma.
Yes.
In front of them at that particular time.
At that moment. And then the third stage, Noyes calls the stage of transcendence, where the individual leaves his self behind, his past history, his body, and moves into a state of bliss, if you will. And it's described in so many beautiful ways. I mean, from Noyes's collection of experiences of clinical death, from our own work, usually the phase of transcendence is accompanied by visions of rainbows and peacock feathers and golden light or glorious white light, or the sky opening up, heavenly music, beautiful clouds swirling all around. I mean, just these extraordinarily exquisite and patterned visions, which on one level almost seem a cliche in the West because those visions of transcendence have been played to the hilt. On the other hand, when we look at the mythological material cross-culturally, these same symbols keep occurring, the rainbow, of course, and the peacock feathers, referring to the state of transcendence.
I know I have heard a number of critics saying that this is all right, but many of these patients have those fantasies because they're religious or they come from primitive areas. What have been your experience, Stan? You mentioned a little while ago that you were working with some very highly intellectual non-believers. Do they experience also this kind of experience?
Well, these, the potential for these experiences seem to be just an inherent part of every human personality structure. There seem to be matrices existing in the deep unconscious, which are beyond the Jungian, the Freudian unconscious. But Jung has described many of these things, probably as a result of his own experience. I think that his very profound experience gave him an insight into what is happening and generated his interest in these areas.
You mentioned that working with some Marxist philosophers, they also had the same similar experiences.
Well, not only Marxist philosophers who were actually fighting religion, not only being atheistic, but I found the same experiences occurring in the sessions of materialistically oriented scientists, in particular positivistically oriented scientists, you know, who are as far from any kind of religious belief or concept as you can imagine.
James has a marvelous description of what he calls the state of illumination or noetic quality. He says, although so similar to states of feeling, mystical states seem to those who experience them to be also states of knowledge. They are states of insight into depths of truth unplumbed by discursive intellect. And I think this is one of the major problems we in the West confront, the fact that reason, rationality, pragmatics cannot possibly untangle the web of paradoxology which mystical states induces. And what we have to do is get into a state of saying there are some questions, like the whole thing of creation, for which we strive and strive for the answers. We unlock all sorts of other doors. But there's something about the playfulness of the universe. There will always be at least one question unanswered, something that which transcends discursive intellect.
Carlos started talking about the LSD-assisted psychotherapy.
Yes.
And I would like to mention something that probably throws a little light on this area. Just the LSD-assisted psychotherapy started at a very pedestrian level. Somehow the data came from several independent sources, but most of them were sort of clinical sources. One of them was Dr. Eric Cast, who was studying actually analgesia. He was studying the influence of different drugs on pain, and he just used LSD as one other substance that potentially can influence pain. Another came from Spring Grove Hospital, where they studied the influence of psychedelic therapy on emotional problems. And what they wanted to influence originally was the depression and the tension and the anxiety and the insomnia of the patients in a very clinical sense. And what happened was that in these instances, this work would transcend the clinical limits. And without exception, the patients would be moving into these realms that we have been discussing, mystical, the religious realms. And as this work was going on, we started discovering these incredible parallels between what's happening in these psychedelic sessions and the actual descriptions of the subjective experiences related to clinical death. What we mentioned before, when patients die and they are resuscitated, and they are able to report what they have experienced in the moments following clinical death. And another source of interest is, of course, the accounts of the posthumous journey of the soul from different cultures, the Egyptian Book of the Dead, the Tibetan Book of the Dead, the mythology of the Huichol Indians. So one of the things we were discovering was that there is a reality that we all will have to experience these quite unusual realms at the moment of our clinical death. That this is not just a sort of intellectual fabrication. This is not a wishful product of our fantasy, but a very, very real experience that can be triggered under certain special circumstances.
Yeah, one thing that really impresses me talking to you and a number of other doctors, psychologists, shamans, is the universality of this transition, the uniformity of description. They describe in many different words, terms, but it seems to me that the Tibetan Book of the Dead condenses in a way what happens throughout the cultures, regardless of background, cultural, nationality of the people. Have you found that sort of uniformity in this voyage beyond life?
Well, I think there is uniformity. There is also tremendous variation. If, for example, you conduct this procedure with different individuals, each of them will have, of course, very, very specific sessions. I've never seen two sessions that were exactly alike. It's just dreams. Very seldom can you find two dreams that would be exactly alike, if ever. Also, if the same individual goes through this procedure repeatedly, it will be different every time. He will be moving into different areas within himself. Every culture has its specific symbology for these states. Yet, there is a deep underlying structure. There is a matrix. There is a cliché. So these experiences are, from one point of view, different, but they have very much in common. And we are interested exactly in these universal aspects, in these matrices that underlie these phenomena.
In terms, you might say, sort of a collective unconscious that applies to all individuals, even all cultures.
Yes. What is interesting. This is a point of view sort of from another angle. I was, for example, working with people who were mostly of Slavic origin when I was still working in Czechoslovakia. Then when I came here, I was working with Afro-Americans. I was working with Anglo-Saxons. And so I have some transcultural sample. We had also the chance to give it to somebody who came from China, who was a Chinese Buddhist. And it seems that these matrices exist in different individuals, and they cover the whole range, or can potentially cover the whole range of cultural phenomena. In other words, you mentioned the Bardo Todel, the Tibetan Book of the Dead. It doesn't have to follow in every individual the Tibetan symbology. But the Tibetan symbology is one of the frameworks in which it can occur. But another person can have much more, let's say, Egyptian elements. We had persons who will have many elements of the pre-Columbian cultures. And it seems that a single individual can, especially in sequential, in serial sessions, go through many of these cultural frameworks. So this is the concept of the Jungian collective unconscious, that actually all the cultures are somehow potentially an intrinsic part of our personality.
Right. And in this regard, I want to ask you also, in the LSD sessions, you see a repetition of the trauma of birth and death. Many times in a number of subjects, you have seen that trauma. They have a sort of anticipation of what they will go through when they approach the actual death.
You see, what you find in LSD sessions, and I think to a great extent in the various cultural frameworks that we have been talking about, is that somehow the experience of death is intimately associated with the experience of being born, to the point that even in certain instances the individuals are slightly confused, disoriented as to what is actually going on. Are they being born or are they dying? Is it a struggle towards being born, or is it a struggle towards staying alive?
Right, yeah.
So it's always a death rebirth. We never mention now any of these components separately, because they always are intimately linked.
The
Associated
sort of
with
duality, death rebirth, is a sort of duality, basically.
No, I don't feel it as a duality. I think it's a parallel.
Parallel.
You know, death and birth seem to have a similar configuration. The cycle, though, of death and rebirth has a cyclical quality, and but I'm not sure where the duality comes in, except, I see where the concept of union and separation occur within the configuration of death and rebirth, where the individual at a certain point experiences a profound sense of union, a unitive oceanic experience, and then separation can occur when the individual goes through a period, a liminal period, and then death and annihilation, and then he moves back into the unitive. But then we can think of the duality of union and separation being a paradigm. But I think death and birth are parallel, but they're also tangent in the sense that in the mythic and tradition, what we see is a configuration of death and then rebirth.
It has an interesting implication. If you look, for example, back into history, you find just about in all historical periods, in all cultures of the world, temple mysteries, initiation rites, mystery religions, specific procedures in which individuals in a structure framework could go through this death rebirth experience on a symbolic level. And it has this interesting ambiguous quality in that on the one hand it was conceived as a preparation for the ultimate transition, for death. Going through the symbolic death rebirth experience prepares you for the ultimate experience of dying. But it also changes somehow your lifestyle, your perception of yourself, your perception of the world, your worldview. You become what they call twice-born, enlightened, illumined beings, so that going through the death is preparation for life.
Right, right. Leonardo da Vinci said, at the end of his life, that famous quote, I always thought I was preparing to live, but now I have seen that I have spent my life preparing to die. But one of your subjects added to that.
Yes, well, he quoted the original Leonardo saying at the time when he was dying. He said, well, I thought I was living, but I was preparing myself to die. And this individual in his training session experienced this profound death rebirth sequence. And in his account, he sort of reformulated. And he said, in my LSD session, I thought I was dying, but what I was actually doing, I was preparing myself to live.
Right. I have a couple of other little things only to ask you. And one thing I would like to ask you, one of your most impressive cases apparently was this young man, Dean, who was going through this very painful terminal cancer illness. What was his actual transition? What did he experience at the very end?
Which he died twice, actually. During his do you want me to describe the event
Yeah,
of his clinical death?
Right.
And then this was a 29-year-old Afro-American who had been diagnosed with terminal cancer 6 years prior to our encounter with him. And at that time, he'd been given 2 weeks to live and was not told his prognosis, nor was he told that he had cancer. He managed to survive the 2-week terminal time against all odds, and 6 years later, he came to us, or was referred to us by his physician, because he had problems with intense physical pain and seemed to have some problems in terms of his illness, psychological problems. He had 3 LSD sessions with us. The first one could be characterized as being a very, almost a paranoid flavored session. He was a tremendous struggle. He was experiencing himself in the house of his foster parents where he had been beaten severely. But finally, after much struggle and many difficulties, he was able to resolve these painful feelings. And the outcome of that session was remarkable in that he had been taking 12, 16 dilaudid a day to deal with his pain and had been bedridden for months. And he was able at that time to go back to work and cut his pill intake down to 1 a day. In November, this first session was in July. November, problems came back. And so in January, we ran the second session. By that time, we had dealt with the issues of diagnosis and prognosis and gone through all the games, unsorted the games between him and his wife. And we had gotten very close to him and his family. And this session we could characterize as a real transcendental experience. He felt that he was in touch with the cycles of life, the cycles of creation, and saw that dissolution, death, decay, entropy was very much a part of the creative process. He also had an experience where he felt that he was very close to God, and he saw God manifested as being an extraordinary, glittering, all-encompassing light. The outcome of this session was very good. Again, a tremendous diminution of pain, very much deep in feeling in relationship to his whole religious outlook, where at a time when he had formerly been disinterested in religion, he became very religious and intent on understanding what religion could do for him. His third session was almost an admixture of both. He had some very beautiful oceanic moments, and then he had some times of struggling, mostly struggling in terms of his relationship with his wife and dealing with areas of trust. I think it was about 6 weeks after this session, he was rehospitalized because the ureter leading from his kidney into his bladder became occluded, and he was no longer able to pass urine, and he became more and more uremic and more dissociated.
He lost one of his kidneys before, he had a nephrectomy.
Right.
And so this was the occlusion of
the remaining kidney. At that time, there was a question as whether or not to operate. His illness was so far progressed, and he had essentially resolved the major issues, personal issues around dying, and the family seemed very set that it was time for him to go. And the surgeons confronted his wife with rather of a problem. They stated that if they operated, he probably would die, but if they didn't, he would certainly die, making the whole question of whether or not to surgically intervene a rather difficult one to make. One morning at about 5 a.m., we received a phone call from his wife, and his wife told us at this time that Dean, the name of this young man, had called her and said that he had seen a vision of Stan and that he needed to see us very badly. We went over to the hospital immediately, but by the time we got there, he was comatose, unable to verbalize. His eyes were glazed, he was barely breathing, his pulse was extremely thready. The family was standing around the bed, and as things were rather complicated and people were upset, I moved very close to Dean and put my arms around Dean and my other arm around Flora, his wife, and held them. And we all were in a circle around the bed, and I began talking to Dean, telling him that there was nothing to fear, that he perhaps was experiencing himself in some kind of darkness, some kind of void, but that there was nothing to fear, that light would come, the light that he had seen already, and that he would pass from darkness into light. I guess we were together for about 5 hours, and in the course of this 5 hours, you could see him fading visibly in front of us. About 10 a.m., there was some sort of noise out in the hallway, and all of a sudden, orderlies came rolling a tray in, and off he went to surgery. And it was really quite difficult for us. We had, all of us, including Stan and I, as the so-called therapists, had resigned ourselves very much to Dean's death, and there was a sense of what's happening here. He went to surgery. They opened him up. They inserted a catheter into a place just below his kidney and drained off the urea. In the course of this procedure, he had 2 cardiac arrests and was resuscitated both times. 8 hours later, Stan and I were able to visit him in the intensive care unit. When we walked in there, Dean was just coming out of anesthesia. He was intubated everywhere. And we saw this very tired eye look at us. And there's a little gleam there, and Dean said to me, as best he could with a tube down his throat, he said, "You changed your dress, Joan." Well, I thought I was going to drop right there because, first of all, by our standards, he was comatose and therefore not able to be an observer in our so-called objective reality. Then he proceeded to very quietly and softly describe to me what we were doing there. He described all of us standing around the bed. At one point, he even told me that he saw tears coming down my cheeks, which I didn't think that he could even focus his eyes. I mean, he was just staring off into space. And as far as we could tell, he was completely aware of objective reality. And then he told about a second level of his experience. He said, "You know, what you were saying, Joan, I was experiencing." He said, "Before you came, it was as though I were in some kind of darkness that was pressing down against me and I could hardly breathe. And somehow you knew that. And as you were talking, I could feel the darkness leaving my body, and I felt light coming. And I didn't know if the light was coming from within or from without." Then he described a third level of his experience. And at this point, he kind of laughed and he said, "You know, it was so much like LSD, all this. Because I'd had the sessions, I wasn't afraid. I wasn't afraid at all. I could just go with it like you told me to do in the sessions." And he said, "You know, I saw something that was very strange. It was like a moving picture on the wall. And it was right there, as though I were really seeing it, and I was. And what I was seeing were the faces of all the people that I killed in Korea, and of all the kids that I beat up when I was a teenager, and all the people that I had hurt in my life. It was like a Last Judgment scene," he said. And then he said, just before he concluded his experience with us, sharing his experience with us, he said, "You know, I don't think I'll have to go through that one again, that Last Judgment. Somehow I felt like all those people forgave me, and I was through with it." Dean was discharged from the hospital. He went home. In a conversation with him several weeks later, he told Stan and us that it was time for him to leave. We said, "What do you mean?" He said, "You know, my body's just shot through with cancer. There's no reason for me to stay here any longer. it's not possible for me to get better. We've tried everything we can, and it's time for me to go someplace else. He was shortly thereafter rehospitalized, and shortly after that, one afternoon, he asked his wife to bring him some fresh pajamas. I haven't even told you this, Stan, because I talked with Flora on the telephone, and I forgot to tell you that Flora went home to get him fresh pajamas, and she knew that the end was very near. And just after she left, Dean put his head on the pillow and left his body in the most peaceful way possible. No one even knew. It was just as though he said, well, I don't want her to be here. It's too painful for her, even though we've dealt with all this, and but I'll send her home for some fresh pajamas. You know, it's so typical for this work that with the facilitating aspect of LSD, opening up the unconscious, inducing an intrinsic rite of passage, that individuals move into death in this most peaceful of ways. There's a beautiful saying that Abbe de Santa Clara has written. It goes simply this: a man who dies before he dies does not die when he dies. And I think that we very much share that sentiment.
And one thing that appalls me that so many hospitals, they keep these patients alive like vegetables for months or even for years sometimes. They don't let them die with dignity and with peace.
Well, I think that one of the things that we have to get out of, and it was interesting, like a lot of people who talked to us referred to these people as patients or as terminal. You know, already they're in social categories which are beyond the ken of humanness. There are roles in our society which are liminal, which they're betwixt and between. They have no function, and the idea of doing that helps us distance ourselves from the terrifying reality of the sickness and death that we might ourselves someday have to face. Our feeling very much is that we should take a very revolutionary approach from the level of social categorical terms, such as using the word patient or terminal to describe these individuals. That's just on the semantic level. And we've got to deal in every way with this problem of dehumanization, of alienation. And one of the most, I think, important aspects is knowing that individuals have rights, and these rights concern themselves up until the time of their death, when they can make decisions regarding how they want to leave their bodies. And I myself feel very strongly that mechanical intervention to prolong my life is something that I do not want under any circumstances. It, to me, seems totally futile, totally absurd. Absurd, I think, is the word it is the word I'm looking for. To mechanically prolong a life when indeed that life is over, there's no reason to do it. Stan and I have made an agreement that you know, if I should become unconscious and my brain is no longer able to function again as a normal brain would, that he will not have me attached up to a machine, because I myself, if at all possible, from our experiences with individuals who are dying and who have died, who are really our teachers, I myself would like to be as fully conscious at the time of my death as possible, and as fully aware of the processes that are occurring, because I personally do not feel that even though the body can be the repository of suffering, that the state of mind, the state of being, can be the body can be the vehicle for your consciousness. And I want my consciousness clear and not manipulated by Western technology, so that I cannot be there for my own transition.
You see, Carlos, in our work with cancer patients, we very frequently encounter this issue of diagnosis and prognosis, how to deal with it, how to approach it. Should the patient be told, or should this be sort of withheld from him? And I think we have a very distinct feeling that the diagnosis should be shared. He should know it, and he, even if he gets temporarily upset, he has to work through it, but sort of confront it as a real issue. We, for example, had a patient who was very rich, and the cancer was diagnosed. She wasn't told for many months, and then when she found out, she was furious because she said, well, there are many things I wanted to do. I wanted to travel to different countries, and it just, my life would have been very different. You know, I would have sort of confronted this issue and trying to reach certain closure, but still enjoy as much as I could, you know, my means, and I wanted to do the things that I always wanted to do. So we believe that this should be done, that the diagnosis should be communicated in a very sort of sensitive, special way. We have very different feelings about prognosis. See, when you diagnose cancer, in most instances there is no question about it. You have a very positive knowledge of what the situation is, and you can communicate something very concrete. Now, in terms of prognosis, this is a very different issue, because no physician can make a reliable prognostic assessment. And as Joan mentioned in Dean's case, they felt that prognosis was about 2 weeks, and 6 years later he was still there. And remember, another patient who was given about 2 months, and 20 years later she was still there. You know, we know that in cancer there are spontaneous remissions, which nobody can explain. It happens in a very small percentage of cases, but the possibility is there. And also we feel that the prognosis depends on many, many variables. For example, psychological variables being a very important part of the total image. So in terms of communicating prognosis, you're really being dishonest.
This means many cases of incredible cures or postponement of the actual process of death after the patient is told, as you say, you know, sometimes after 20 years.
In most instances, this can be done only statistically. Let's say if 1,000 people had this diagnosis, they happen to live, you know, on average. But then in terms of individual cases, you can't really make an accurate prognosis. And if you make that kind of prognosis, then it becomes actually one of the variables that can influence the patient.
And besides, death, for all what you have been saying, is not a painful process, but a very enlightening process. It's a sort of a rebirth. And we're talking so much these days about reincarnation, recycling of souls, and people have said that they have coined that term. And I think that basically that's what it is. It's a sort of a passage to another realm, and who knows, maybe coming back to this realm or to another.
I think, though, Carlos, we should be very clear about one thing, that no transition, or none of the transitions that I've ever known about have been without suffering. And what I feel that's important to communicate is that suffering in the West usually has no meaning. And in rites of passage, when an individual goes through a period of suffering, as inevitably an individual does in a rite of passage, or at the event of death, there is always a period of suffering. The suffering has meaning, and the meaning gives the event relevance. And what we experience in our Western society is a sense of the absurd, a sense of irreverence and irrelevance. And it's very difficult to confront death from that point of view. Death has no meaning.
I think our concept of death is very heavily influenced by the media. I mentioned it in the conference in Goleta. You know, we either are confronted with death in the television, in the movies, the newspaper articles, in an absolutely absurd way. For example, in Western time movies or detective stories, the moment of death is somehow equated with defeat. The guy is shot, he is sort of conquered by somebody else, his possessions are sort of taken away, which is a very specific programming in terms of what death means. Or in the other extreme, we are getting very empty, abstract concepts of death that we can't relate to. Like when we are confronted with reports about hundreds of people dying in jet crashes or catastrophes, hundreds of people killed in wars, you know, we can conceive in terms of numbers, but we find it very difficult to see the individual tragedies that it entails. And perhaps the emotional and the spiritual, philosophical significance of those individual events that go into this.
Several months ago, a close friend of ours asked us to come to New York to see his aunt who was dying of cancer. And we went there and met this beautiful woman who had lived a life of superficialities. And as she was approaching her death, she decided that somehow she must find some meaning in her life. And she made some kind of a commitment really to herself, but to us, that wherever we thought it was good to go, she would go with us there. So in the process of so-called therapy, and it's ridiculous to call it therapy because it's an interactional process that affects Stan and I as deeply, I'm sure, as it affects the people with whom we're spending our time. In the process of our being together, we became very involved with the family network and realized that this was a Russian Jewish family who hadn't talked to each other in about 4 decades. There was so much dysphoria in this family, and particularly in relationship to her adopted son, there was a lot of pain because he had many, many social problems. She had an exquisite session with LSD. We took her down to Maryland and gave her LSD after spending much time with her in preparation for the session. And in one of our meetings after the session day when we were back in New York, the son was there and his wife and Stan and I and Helen is the individual involved here. And Helen wanted to communicate to her son that she was not perfect. She said to him, you know, I don't want to be a tin Jesus to you, David. I have to tell you, I've made a lot of mistakes. And she just started sharing with him all the places where she had fallen down as a mother, as a human being, as a woman, all of her frailties, her weaknesses. And in the process of this, I looked into her son's face. I know my face was absolutely wet with tears. His tears were streaming down his face, and we all just moved it in together and held each other, which was very unusual for this family to do since they were a non-touching family. And it was a real extraordinary moment of communion. And after a time, she leaned back in this big armchair where she was resting. She said, you know, now I know that my death has meaning. That my death has catalyzed, my dying and my death has catalyzed and facilitated communication in this family where if I hadn't have been going through the suffering, nothing would have happened. She died a month later, and her nephew's wife was there at the time of her passing, and it was again one of those deaths where it was in total and utter peace, and they were playing music for her, and she was with her loved ones, and it was very gentle. And Nornie, the wife, called us up. It was midnight, California time, and 3 a.m. New York time, and we had actually, at the time of Helen's death, we had actually been with Joseph Campbell talking about the Tibetan Book of the Dead. And Nornie, we had gotten home, and Nornie had been calling us up for some time, and she finally got us, and she said, you know, Helen died. She said, I think everything was perfect except for one thing. And I said, what was that, Nornie? She said, well, you know, you told me about the light, Joan. She said, just after she died, they pulled a sheet over her face, and you told me that the brain doesn't die for 10 minutes until after the heart has stopped, and then the older neural pathways might even be 20 minutes. And I felt awful. I wanted to take the sheet away. And The simplest and most honest thing I could communicate to her was the light comes from inside. So everything was perfect.
And finally, in closing, I would like to ask you, each one of you, you have any words or something to say to people who are faced with the imminent prospect of the ultimate passage of death from this existence to another?
Well, I think two most important things that come to my mind is one is the importance of the human communication, not only for the dying person but for his milieu, whether it's the medical staff or the family members, to be able to be in touch with their own feelings, try to be in touch with the dying person's feelings, and to be able to have very honest, open, straightforward communication, so that something that is otherwise perceived as a very disastrous, tragic situation can become a very meaningful, emotional, philosophical, and also spiritual, also transcendental experience, so that it can make the transition easier for the dying person, but also set a better alternative model for the survivors, who one day, sooner or later, will be confronted with the same situation. And I think the second important thing is that the fact of death itself, in terms of concept of death and the attitude towards dying, can be perceived in many different ways. It can be experienced on many different levels. And our prevailing Western type of approach to dying is just one of many, many alternatives. And I think one of the things we are trying to do in the LSD-assisted psychotherapy or in transpersonal psychotherapy is to open these levels within ourselves, because the matrices are there, and create a sort of experiential, conceptual framework in which somehow the transition is experienced as much easier. You know, we can see the other extreme in some other cultures, which is very real. I saw it, for example, in India and Benares, where people come to die because it's the holiest place for the Hindus. In the extremes, the fact of death can be experienced as exactly the opposite, as not being the ultimate defeat, as the ultimate catastrophe, but a situation of spiritual liberation, where the individual returns back to where he came from, which is the cosmic pool of consciousness. And being here, experiencing this level, is to be trapped in a certain kind of illusion, is almost like being in exile. I'm not making judgments as to which of them is true or which of them is better, just sort of opening the possibility that there are many, many different ways in which people can perceive this sort of all-human situation.
And although the process is painful, ultimately ends up in this blissful state.
Yes.
Do you have any feelings about that, John, about the people who are facing the prospect of death?
Well, I have some feelings about the people who are with the people who are facing the prospect of imminent death. And that is that, from my experience, which is the only place I can talk from, that the most meaningful place to be is very centered inside of yourself and open to whatever happens, including your own feelings of grief, your own feelings of loss, separation, and sorrow. That these feelings inevitably emerge, and that to ignore them, to deny them, is not where it's at. It creates a lot of problems in the future time. And that I know that in my own process, personal unfolding, as we work with each individual, I have gone through transformation after transformation after transformation. And one has to be willing to let oneself go through those experiences. They're as important to you as they are to the person with whom you're working. You are sharing a state, a place, a time. And the sharing of that moment in all of its integrity is so important.
Best in this state.
I think it might be very interesting to talk not about one of our patients, but an experience that Carl Jung had at the time of a heart attack when he died a so-called clinical death. I have an account here which might be appropriate to read. It's very,
Yes,
very beautiful.
Please.
Jung has this account of what happened to him after a heart attack when he was in a state of unconsciousness and he literally hung on the edge of death. He said, "I found myself in an utterly transformed state. It was as if I were in an ecstasy. I felt as though I were floating in space, as though I were safe in the womb of the universe, in a tremendous void, but filled with the highest possible feeling of happiness. This too is eternal bliss," I thought. "This cannot be described. It is far too wonderful." In the course of his experience, Jung found himself floating away from the earth, which he saw from a distance of 1,000 miles and bathed in a glorious blue light. As the experience progressed, he envisioned himself standing before a temple, the door of which was surrounded by a wreath of flames. "As I approached," Jung said, "I had the feeling that everything was being sloughed away, everything I aimed at, or wished for, or thought, the whole phantasmagoria of earthly existence fell away or was stripped from me, an extremely painful process. I had the certainty that I was about to enter an illuminated room and would meet there all those people to whom I belong in reality. There I would at last understand, this too was a certainty, what historical nexus my life fitted into." Jung then for a time saw himself in an enchanted garden of pomegranates, where all was beautiful and peaceful. Of the entire experience, he said, "It is impossible to convey the beauty and intensity of emotion during these visions. They were the most tremendous things I have ever experienced. I can describe the experience only as the ecstasy of a non-temporal state in which present, past, and future are one. Everything that happens in time had been brought together into a concrete whole. I was interwoven into an indescribable whole and yet observed it with complete objectivity." I feel that that description has a tremendous validity. We, in the course of our work with individuals who are dying of cancer, have had several occasions to hear the accounts from our own patients of their own clinical deaths.
On today's program, I will touch on the subject of death, that ultimate passage from this life into another realm, a passage that we all face in this, our terrestrial life. Some time ago, I had an interview with Stanislav Grof and Joan Halifax Grof. Stanislav Grof is the well-known Czech medical doctor and researcher who has done extensive work on the use of LSD in terminal cancer patients. Much of his work has been done in Maryland at the Maryland Psychiatric Research Center and various hospitals of that area. Joan Halifax Grof, his wife, is an outstanding anthropologist who has done considerable work in the subject of rites of passage, especially in the Caribbean and North African areas. Together they form a remarkable couple who, with great knowledge, compassion, and human warmth, have done much to ease the pain and anguish of terminal patients and help them in their ultimate transition from this life. So I present now portions of that conversation I had with them. Stan and John, I was interested especially about what we might call the ultimate rite of passage, that is death. And you have been doing a lot of research with terminal cancer patients and LSD. And I would like to ask you if you could describe briefly what you have observed in this passage, in this transition from life to death in these patients. Some of the feelings that they have expressed.